You are a healthcare provider and then just saw this teenager who seems to have what is called functional neurological disorder, short for FND. Well, if you don't know much about FND, there is actually a pretty good chance that you're making this child patient and the family members homeless. And here's why. Hi, Dr. Lee here. I'm a pediatric health psychologist and teen FND specialist. I've been helping hundreds of teens who's been struggling with FND, and they not only got their life back by resolving FND, they're actually thriving in their lives. So today's video is for you, healthcare providers. And if you're a parent of the teen who is struggling with FND or just got diagnosis of FND and then you're frantically searching and Googling what FND is, then I highly recommend that you share this video with the healthcare provider who gave your child the diagnosis of FND or pediatrician. I mean, any healthcare providers that you work with, that you know of, that you came across with, because everybody needs to know what FND is. So today's video is in 3 parts. One is what's really going on, the current challenges and problem with these families who's got FND diagnosis, and why you have to have a really good understanding of what FND is. And the third point is what to say and what not to say when you diagnose your patient with FND. So let's get started. So here's usually what happens with the big problems with teen FND based on working with, like I said, hundreds of families who've gone through this process. It kind of goes like this. A child is having these problems, whether it's a frequent fainting or losing control of their body, extreme panic attacks, changing personalities and behaviors and things like that. And then, of course, what do? Parents take the child to a pediatrician, urgent care, ER, usually in that order. And then along the way, whether it's from the pediatrician or urgent care or usually ER and then the specialist, typically neurologist, then the family gets this diagnosis of FND. From the family's perspective, though, this is exactly what they're experiencing. Something like doctors are scratching their heads, telling the families, well, all the tests look normal and we can't find anything. So we think your child has FND. Well, there's nothing we can do other than you need to find a therapist because it's all mental health problem. Good luck. Then what happens is the family is dumped back on the street while feeling very confused, frustrated, and desperate. Meanwhile, the child continues to experience these symptoms like she can't go to school, isolated from friends and other social activities, and at least one parent quits their job to stay with the child, like full-time daycare all over again. And then the parents are arguing about what to do. Their marriage falls apart and they're on the blink of divorcing or separating or constant disagreement. And then the child feels very guilty for being a burden. That's right. These families are, in a way, like homeless in this medical system with no directions or what to do. But why? If this is a cancer, for example, none of the doctors will say, well, there's nothing we can do, so you're on your own, good luck. No. So how is FND different from all of the other diagnoses? Well, the bottleneck is you providers don't know what to do and where to send these patients to. And to be fair, here is what the research studies say for you guys, healthcare providers. Well, here's the deal. Over 90% of the medical school don't even talk about FND. So again, how could you know what FND is if you haven't even learned about it, right? And up until not too long ago, FND was called conversion disorder. And this is probably why most of the medical schools don't even talk about FND, because conversion disorder was indeed considered a pure mental health disorder. And to be really fair, historically, even a lot of mental health professionals would have shied away from treating conversion disorder cases because conversion disorder was almost considered in the same category as serious mental illness, such as schizophrenia, bipolar disorder, borderline personality disorder, all of which have common denominator with FND, well, it used to be called conversion, as serious functional impairment is present in that individual who is struggling with these conditions. That's why convergent disorder now, FND, is still considered almost like hush hush, very stigmatized diagnosis, and most healthcare providers don't really know what to do. Well, that's why I can only imagine that you would want to send these patients to a mental health professionals. I get it. But here is the but. In the past 10 to 15 years, what's happening is, well, thanks to more research studies, FND is no longer considered a pure mental health disorder. The problem is that the medical school is not quite up to date, maybe when you went to the medical school as well. So once again, most doctors don't know much about FND. So that is a huge, huge problem and the gap in the service. So why do you have to have a good understanding about FND? Look, for the most part, if you are a neurologist, pediatrician, PA, nurse practitioner, whoever you are not likely to be actually treating these patients with FND because most of the treatments are done by pediatric psychologists like myself or physical therapy, occupational therapy, depending on what kind of FND symptoms these individuals are struggling with. So back to why you have to have good understanding. Well, first of all, it is your duty. You just don't dump your patient on the street. Like if this teen has a cancer diagnosis, you're not going to say, well, I don't treat cancer, therefore you're on your own. Good luck. You don't do that. What you would do is you would likely be connected and partner with some sort of specialist. And so you would have a system. All right, here's a diagnosis and here is someone who can help you. So let me walk you to that person, right? So why don't we do the same thing for FND instead of dumping these teens and their parents like they're homeless and orphan, right? So that's what I'm trying to change here. And it is part of my mission, by the way, if you can't tell already. Let's not make these families homeless again, ever, at least in your practice. So what is FND? So this is where you have to have a good understanding, right? So FND is an umbrella term to describe this cross-wired communication problems between the brain and the body when physically and then structurally your patient's body is quote unquote fine, right? And FND, again, is a very common diagnosis you would get in neurology clinic. That means you can also give that diagnosis as long as the patient meets the criteria. And other terms of FND is, depending on the symptoms, non-epileptic seizures, psychogenic non-epileptic seizures, so NES or PNES. Those are the most commonly diagnosed subcategories of FND, or functional seizures, and functional movement disorder, functional paralysis, functional tics, functional ABC, etc., etc. And just so you know, PNES and FND are same thing. PNES is a type of FND. Again, FND is a category, and within that category, there are subcategories. Functional seizures, NES, PNES, functional movement disorder, functional paralysis, blah, 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 blah. All right? Which, by the way, chronic pain, complex regional pain syndrome, CRPS, is part of the FND as well. And FND is a biopsychosocial phenomenon. Like I said, conversion disorder was used to be considered a pure mental health disorder. And now FND is no longer a pure mental health disorder. It's kind of funny, or not really haha funny, but like interesting coming from a psychologist. But FND is a biopsychosocial phenomenon. So it's a biological, psychological, and social phenomenon. Everyone who has FND has something to do with all of these three categories. So it's never, ever a one thing that is causing anyone to have FND episode, symptom, diagnosis. And here's a kicker. FND is no longer considered a diagnosis of exclusion. It is considered a diagnosis of inclusion. So things like you go through all the tests, and then there are specific tests that you actually have to do to determine the inclusion or the presence of FND. So you cannot tell your patients, well, we can't find anything, therefore it must be FND. kind of thing. You have to have a good reasoning for delivering the diagnosis of FND. For those who are general practice providers, I really want you to take this home. The teen or pediatric FND is not the same thing as an adult FND, which I'm going to talk more about what not to do and what not to say. So let's get to it. What to say about delivering the diagnosis of FND? Number one, be accurate. Say something like, your child or you have a diagnosis called functional neurological disorder, short for FND, or you can be very specific about your child or you have non-epileptic seizures or psychogenic non-epileptic seizures or non-epileptic episode. I mean, there are 10,000 different names, but you can be specific about that. That's totally fine. But make sure to name it instead of, well, your child doesn't have an epilepsy, so it must be something else, kind of thing. Make sure that you name the proper diagnosis. And you also tell them it is a real diagnosis, but it is different from epilepsy if the patient has a functional seizures. I had a few families tell me, well, we didn't get any diagnosis. All we were told was that my child does not have epilepsy. So they didn't put two and two together. Either this provider didn't give the actual diagnosis, or the provider said, well, what your child has is non-epileptic seizures, but the parents registered as, wow, my child does not have epilepsy. What then? So there is a gap in the communication. So make sure to be accurate and then describe, which leads to the second part of what to say. Be educational. Talk about what you did to conclude the diagnosis instead of, once again, well, we did everything and everything looks normal, kind of thing. Just walk them through, because these are the families who are on the verge of becoming, again, homeless or orphan if you don't provide the accurate and educational information. And again, name what you observe during your exams and evaluations, right? So be specific and talk about the difference between FND and other neurological disorders like epilepsy and MS, for example, right? So talk about the differences between FND and something else. And what you want to do from the get-go is, again, this is so that you know as well, promote normal daily activities, including sleep, eating, school, and extracurricular activities. You cannot, which I'm going to talk about what not to do, but I'm just going to have a peek preview. You cannot remove your patient out of all these activities. It's the opposite. You need to sort of insert back, to the daily functioning. And educate parents. Again, pediatric FND parents, they go hand in hand. So educate parents what to do and what not to do. And I have tons and tons of videos about on my channel what FND is, what parents can do, and what they shouldn't be doing, all of that. So refer them back to my channel. And you can also offer a support letter and FND action plan for your patient's school. And luckily, I do have all the handouts. So click the link down below, which leads to the third point. Be compassionate. Validate your patient and their family. They are terrified, they're frustrated, they're confused, they are desperate. Validate, validate, validate. And you are going to use active listening, reflecting their feelings and summarizing and following up. And just wait and be patient and have a space and room for the family to ask questions if they have any. And let's talk about number 4, which is what not to say. Don't say it like this. Absolutely do not say your child is faking for attention, because they're not. Absolutely do not say it's all in your head, because what's in their head is brain, all right? That's about it. So please, please stop saying it is all in your head or anything related to that, because that's what the family is registering. And also, there is nothing wrong with your child. Again, it can be coming from a place of encouragement, but that can be also discouraging for the family. So don't say that. And absolutely, under any circumstances, please do not say you're wasting my time, because I have heard from so many families that we keep going back to the doctors and then they tell us you're wasting my time. So please, please validate. Don't say that. Stop giving arbitrarily timeline for recovery. This is setting your child and your patient for absolute nightmare and failure. I can guarantee you that. So I hear so many families tell me, well, my doctor said I would be done in 3 months and then you should be better. And my doctor said the second I hear the diagnosis, then I should be cured. And my doctor is saying that you should be better within the next year. Please don't, unless you have absolute science and data and guarantee that this is a timeline that your child patient is going to get better. Parents are desperate, so they're going to ask you, well, approximately how long does it take usually, for these kids with this diagnosis to get better? Please don't. Just tell them it varies case by case. Some kids get better sooner than later. But what is really going to matter is the sooner you start the treatment or healing journey, the faster they can get better. I cannot tell you how many times these families get very hung up on this timeline as if that's like the black and white, some sort of like a light bulb switch. Oh, all I need to do is just wait for 3 months. All I need to do is just for a month or whatever, a year or something like that. And then when the time comes, they don't get better. Kids get so devastated. So absolutely, please do not stop saying the timeline because it does not mean anything. And I will say a little bit of a sort of big picture here. Let's just say your patient started having this FND symptom, let's just say in the last month. So generally speaking, the prognosis is really good, right? Because the faster, you discover the diagnosis of FND and the faster you can get the treatment started, the faster you can recover. But guess what? If this patient has been struggling with, let's just say, chronic pain for the last 10 years, remember, chronic pain is also part of the FND. So suddenly, FND is not just 1 month, it's the 10 years and 1 month. So guess what? The prognosis of this FND getting better suddenly can be very, very long time. So please do not give false arbitrary timeline. Again, you're likely coming from the good place and good intention, all of that. I get it. I work with healthcare providers all day long. I am coming from a hospital setting, so I get it. And let's just be accurate. So moving on. Okay, please don't say this too. The reason why your child has FND is because of stress and anxiety. Well, first of all, you don't know that. So stop overemphasizing mental health as a reason for the kids' FND, because many kids actually don't have any psychiatric concerns or trauma for that matter. So this is part of the reasons why the teen FND or pediatric FND is different from adult FND. In adult FND world, over 90%, statistically speaking, is related to some sort of childhood trauma or some sort of adverse events and things like that. Pediatric FND, that's like a less than half of the time. So don't just emphasize and insist that your child patient has some sort of stressor, anxiety, and or trauma, okay? That itself is very traumatizing for your patient, in case you haven't noticed. So please don't do that. Related to that, stop over asking what trauma the child has had. Just don't. Please don't. This is really, really harmful for your patient and their parents. Because what's happening with the parents is now they're wondering, oh my gosh, maybe it's the time that we had this babysitter 10 years ago and we were not home and then maybe something happened, and they're so going around and round and round and sort of like going nuts, just trying to figure out what they have missed and then feeling very guilty about it. So please stop over asking what trauma this child had. The fact that you're asking the question is traumatizing to the child and then the parents. Also, please stop encouraging the use of disability services like assisted devices, including service dogs. All right. There's absolutely nothing wrong with service dogs. For the FND, if the kid wants to get better, assisted devices is almost like a rubber stamp that they're not going to get better. All right. So I'm pretty sure you as a healthcare providers want to help your patients get better. So Please encourage the normal daily functioning instead of putting this child into this permanent disability box and encouraging the use of these assistive devices. And luckily, I do have a video about what to do with assistive devices, including service dogs. So please check that out as well. All right. Please also stop encouraging the parents to basically give their child cut some slacks, like, removing from responsibilities and daily activities and things like that. So under no circumstances, generally speaking, please stop asking the parents, oh, maybe your child shouldn't be going to school. Maybe your child shouldn't be doing any chores. Oh no, your child needs to stay home like all day, every day. Please, that is literally detrimental and reinforcing and perpetuating the FND symptoms. So please stop encouraging. Do the opposite. Encourage the normal activities. And this is it too. I know you want to know what the status is with the symptoms, but please stop asking the parents and the child to keep track of each episode's logs. Once again, more attention being drawn to FND from anybody and everybody, the more perpetuating these FND symptoms would be. Therefore, you don't even need to ask the parents and the child to keep logging how long it was, what exactly was happening, all of that stuff. The parents do not need to be detective. I want them to invest rather in their child going back to normal daily functioning. So please stop asking these questions. You can encourage the parents to stop asking these questions as well to the child. And also, this is a bit of a tricky thing, but I will put it out there. Please just don't tell the child and the family, all you need is a CBT therapist. What the family needs is an FND specialist, more so than CBT specialist. CBT is part of the treatment process and approaches to resolve FND, but that's not it. It is a pretty good chunk of the part. However, if the child is seeing just a CBT therapist who doesn't know anything about FND, that can have a huge negative impact. At the very least, the child is going to feel like, well, nobody understands and they're not going to help me. Rather than introducing or referring to a CBT therapist, refer the patient to an FND specialist. And I've seen this as well. Please don't say your child needs to see an in-person therapist. Look, that might be ideal, and especially with the younger kids, younger age child, yes, I get it. However, what the family needs is an FND specialist, regardless of how the treatment is being done, whether it's an in-person or telehealth. I have seen plenty of my patients and the people on my online program, they're all telehealth and they do get better. In person, they do get better as well. It's not how the support is delivered, it's who you work with. So, what can you do as a healthcare provider? 3 things. Number 1, make sure the diagnosis of FND is correct, and you should be able to spell out, because there's got to be a clear evidence of incompatibility with a neurological or medical condition. So you should be able to spell out what you're observing and then how you got to the diagnosis. Educate with compassion to your patient, please. And please follow stuff that I mentioned not to say, because these are all detrimental to the families. And that is just further pushing these people out to the street like homeless and orphan. And most importantly, I would encourage you to partner with just like any other specialist, but in this case, partner with a pediatric psychologist, someone like me or anyone else who is a pediatric health psychologist. Normally, people like us live in the hospital settings, but luckily, some of us, we're ready to help these teens, as opposed to dumping them on the street like homeless or orphan, or referring the patients to just about any therapist, because then usually that's coming from A, good place, and then B, you might be thinking this is a mental health problem, therefore the child needs to see a therapist. Well, it's not that simple. Your referral and then your recommendation potentially is a tipping point for families having the negative expectations and negative outcome, or positive expectations and positive outcome. So please consider you have a huge influence. Please do not underestimate the power of the influence you can have on your patients, either negative or very positive. And as I mentioned, I have tons of free resources for you in this channel and also handouts down below. And I am very, very open to having discussions and further help you to navigate so then you are not creating any more homeless in the medical system, especially for teens who's been diagnosed with FND, because they deserve so much better in their lives. And I've seen time and time again, these kids do get better. So please, please don't take the hope out of them. Thank you so much for watching this video, and I will see you in the next video.